Hi, everyone, and welcome to today's WALPIN webinar. I'm Marcy Hubbs, the manager of Well Ahead Louisiana's Provider Education Network, or what we call WALPIN. Thank you so much for joining us today. Today, we bring you a webinar regarding the value of community health workers, and we have Ms. Catherine Gray Haywood, very well versed on the subject, to be presenting. Ms. Catherine Gray Haywood is current director of Louisiana Association of Community Health Outreach Network, or LASHAN. Ms. Haywood received her Bachelor of Social Work from Southern University at New Orleans, and she has worked for the last 30 years advocating for individuals living below the poverty levels, also working to educate communities around health disparities such as HIV, AIDS, breast and cervical cancers, and other cancers, obesity, and active living. She's one of the founding members of Women with a Vision, a nonprofit organization that has been in existence for the last 30 years. She provides structured mentoring process for the community members about the PRC's activities. She also implements training programs for community residents, barbers, stylists, and healthcare providers around health issues. Catherine provides information on webinars that presents CBPR for organizations and neighborhood associations. Catherine works with the LSU School of Public Health on a number of projects like Resilience Baton Rouge and C-Learn. In the past, she has worked with ex-offenders in the pre-release program through Community Service Center. She was a co-regional director for the South Region for the National Community Committee on the Executive Board of the Louisiana Cancer Control Partnership and the Leadership Committee for the American Cancer Society's Coffee Program. She is also a Community Health Worker Common Core Fellow. I bring to you Ms. Catherine Haywood. She will now present. Thank you, Catherine.
So, good morning. Today we will talk about the value of community health workers. And so, in the beginning, it's what you'll get from this particular presentation. So you'll get the definition of community health workers, roles of community health workers, and the link between healthcare, government, and social service resources. So, okay, here we go. So the community health worker definition, which we use the American Public Health definition from the American Public Health Association. So the CHW is a frontline public health worker who is a trusted member of and/or has an unusual close understanding of the community served. This trusting relationship enables the CHW to serve as a liaison, link, intermediate between health, social services, and the community to facilitate access to services and improve the quality and cultural competencies of service delivery. A CHW also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. This definition is widely accepted and used by professional groups and in policy documents. Next, please. Thank you. Who are we and who are community health workers? CHWs are people who generally come from the community they serve and are therefore uniquely prepared to provide culturally and linguistically appropriate services. They work with diverse communities who are most at risk of illnesses, disability, and death. So there's a range of services that CHWs perform. They do outreach, they do home visits, health education, client counseling, case management, and advocate for social change that promotes the health and welfare. And also, CHWs are employed in many different models of care. They are members of primary care teams, patient navigators, providers, non-clinical services, screening and education, outreach, enrollment, informed consenting specific programs or services. And this was taken from HRS Community CHW National Workforce Study in 2007, and it still holds today. The roles of community health workers create connection between vulnerable populations and healthcare systems, facilitate healthcare and social service system navigation, ensure cultural competencies among healthcare professionals serving vulnerable populations, providing cultural appropriate health education on topics related to chronic disease prevention, advocating for underserved individuals to receive appropriate services, and building capacity to address health issues. CHWs promote access to services, provide health education, support care delivery, and again, promote advocacy. And the use of CHWs increase engagement to promote linkages between health systems and community resources for adults with. So where do you find community CHWs or community health workers? CHWs are found in community-based organizations, the Office of Public Health, hospitals, clinics, and others. Achievable behavioral change with the help of CHWs. So there are positive effects that CHWs can have access to care and health outcome, and these effects include greater use of preventive care such as cancer screening and vaccination, improved management of chronic disease such as diabetes and heart disease, in greater numbers of patients connected to primary care, helping people avoid costly emergency department visits and hospital stays. Community health workers increase engagement to promote linkages between health systems and community resources for adults with high blood pressure, prediabetes, and those who are at risk for type 2 diabetes. And before we move to the next slide, it helps people to understand their blood pressure and their medication and what puts them at risk for type 2 diabetes. Thank you. Next slide, please. How can CHW support the prevention and control of chronic disease and assist in self-management by patients? Clearly, CHWs can help overcome barriers to controlling chronic disease. In 1998, the National Community Health Advisory Study conducted by the University of Arizona and funded by Annie E. Casey Foundation identified the core roles, competencies, and qualities of CHW after contacting almost 400 of these workers. 7 core roles were identified and continue to guide the field today. Bridging cultural mediation between communities and the healthcare system, providing cultural appropriate and accessible health education and information, often by using popular education methods. Ensuring that people get the services they need, providing informal counseling and social support, advocating for individuals and communities, providing direct services such as basic first aid and administering health screening tests, building individual and community capacity. In addition to these general roles, CHWs can provide support to multidisciplinary healthcare teams in the prevention and control of chronic disease through the following functions: providing outreach to individuals in the community setting, measuring and monitoring blood pressure, educating patients and their families on the importance of lifestyle changes or on adherence to their medication regimens and recommended treatments, and finding ways to increase compliance with medication. Helping patients navigate healthcare systems by providing assistance with enrollment, appointments, referral, and transportation to and from appointments, promoting continually of health services, arranging for child care or rides, and arranging for bilingual providers or translators. Providing social support by listening to the concerns of patients and their family members and helping them solve problems, creating community clinical linkages to help create a team-based approach through supporting and enhancing the work of healthcare team. Assisting how well a self-management plan is helping patients to meet their goals, supporting patients' self-management plans and long-term self-management support, supporting work of the chronic care team, and increasing the team's cultural competencies when serving as an intricate member of a healthcare team, supporting individualized goal setting and playing a role in self-management program administered by leading or supporting self-management programs. More recent literature confirms these roles. What can CHWs do to help with diabetes prevention programs and self-monitoring blood pressure program? Implement combined diet and physical promotion programs, counseling, coaching, and a combination of both. Develop case management intervention in order to coordinate and provide health care for all people affected by diabetes. CHWs may provide education about diabetes prevention and lifestyle modification or informal counseling, coaching, and extended support for community-based settings. This is my information. If anyone needs to get in touch with me or you just want to be a part of LaShawn, if you go to LaShawn's Gmail, you will be added to our Google list, our Google email list, and you will constantly get information from us. Our office number is listed and LaShawn's website. Thank you.
Thank you, Catherine.
Questions?
Thank you so much. Thank you so much for sharing that information. And I just had just a few questions for you, if you don't mind talking that over with me. Some things I think some of our listeners may be curious about. So if you could let me know, is there a certification in Louisiana for community health workers?
At the moment, no. There is, Louisiana does not have a certification program at all. I'm not sure when or if that's going to happen. We just finished a subcommittee about certification, and the consensus at the moment is that we will just be able to have more training in Louisiana for CHWs and not a certification.
Okay, that sounds great. How can providers locate a CHW? So if they wanted to employ or have a CHW assist in their facility, how can they locate a CHW?
So I would say that the best way to find a lot of times is by word of mouth, but because we're talking about clinics or other employers, there is a website that's called Indeed, who lists community job openings and where community health workers are. They can also go to a community, contact a community-based organization like LaShawn that will have knowledge of where CHWs are and who to contact just in case the organization knows a CHW that may need some work or would be qualified to work within the clinic, or they can partner with a community-based organization to have a CHW work with them from that organization.
Okay. Since there is not a certification in Louisiana, would you find a community health worker maybe under a different title or other roles that do the similar thing that would serve the same purpose as a community health worker?
So there are so many different names, and I think we may have mentioned like patient navigators. There are CHWs advisors. I'm sorry, not CHW. Community health advisors. There are CHW or health coaches. So there are a number of names that we fall under umbrella of, or people who fall under that umbrella of a CHW.
Okay.
So there's a whole list. And sometimes we have to sit back and say, okay, because sometimes people don't understand and they'll say, I do this, and that's fine, but you're under this umbrella. We've had people to tell us that all the time because that's not their job title at all. It's totally something else. So, but they fall under that particular umbrella of a community health worker.
Okay,
And
good.
I only gave you a few. I mean, I only gave you 2 or 3, but that's the,
Okay.
you know, it's a lot.
Well, that's good information. At least we know we can look out for some other, titles that could serve the same role. So if someone in the community is looking to become a community health worker, where would they start? What would you suggest is their starting point?
They're starting for a number. What I found in the future, in the past, is not so much somebody deciding, oh, I'm going to be a community health worker, but if a job opening comes up, let's say in a community-based organization, people are hired who may have never had the skill, but are a trusted member of their community. They know the community and they know how to work within that community. They get trained through their job for one, depending on what they're hired to do, but along with there's training for community health workers that their organization can get in touch with, let's say LaShawn, because we do trainings, get in touch with to have that person or those number of people trained as community health worker. Now, we do have some people who just say, okay, I'm going to do this training on my own, and which is good. But I have to say there is a fee for the training. And I've had people in other parts of the United States who have actually paid for their own training so that they can become a CHW. And then like that, they're already qualified and part of what that job may decide they're going to do.
Okay, sounds good. So I see the LaShawn website listed here. Are there any other websites you would recommend? And maybe LaShawn is the one-stop shop for any resources or to learn about trainings, any upcoming trainings for community health workers. But outside of that, are there any other websites you would suggest or direct anyone to that wanted more information or resources regarding community health workers?
So there's the National Association of Community Health Workers. So their website is info@nachwa. So it's NACHW.org. Along with LaShawn, and we are a member of NACHWA. Also, CDC has information for community health workers. There's others, but those are the 3 main ones.
All right, well, that sounds good. Thank you so much for answering those questions for me. I think they're really helpful and will help any listeners, learn more about and get, started with either employing a community health worker or becoming a community health worker. So that is very helpful. So I guess, we'll wrap it up here. If any listeners have further questions regarding any material Ms. Haywood presented today, you can contact her at her email address here, gray.catherine1949@gmail.com. So thank you so much for joining us today. Thank you so much for joining us. And if you would like to learn about more WALPN trainings and education available online, please visit our provider education section of www.walpn.org, and also continue to follow our newsletter for any upcoming live trainings and webinars and other resources available. So thank you so much for joining us. We'll see you next time. Have a great day.
Bye.